Welcome to Group Insurance Daily Pulse, your rapid-fire deep dive into the critical market shifts impacting group benefits. Now, here are your hosts, Aria the Actuary and Dorian the Distribution Expert.
Good morning, Group Insurance Nation. Dorian here, bringing you the latest data drops and market opportunities. It's Monday, June 23rd, 2026, and the benefits landscape is moving fast. And Aria here, ready to dissect the actuarial implications and regulatory friction of every single data point. Fast often means risky, Dorian. Let's get straight to it.
Absolutely, Aria. Our first item out of the gate, a fresh Prudential financial study released just yesterday, June 22nd, 2026, on AI adoption and benefits. Employers are clearly bullish, with 83% interested in AI for benefits understanding.
Bullish or perhaps blindly optimistic, Dorian. While 83% employer interest sounds impressive, the employee side tells a starkly different story. Only 58% of employees would even consider using AI for benefits, and a mere 24% currently do. That's a 27-point perception gap between employers, 78. Building trust is a lovely sentiment, Dorian, but the data screams caution. Privacy and security are top concerns for both employers, 49%, and employees, 52%. More critically, employees are twice as likely to distrust AI in general, 25% versus 12% of employers. This isn't just about data management, it's fundamental skepticism. From a regulatory standpoint, any AI tool handling protected health information or personally identifiable information under ERISA or state DOI mandates faces intense scrutiny. A data breach, even from an AI vendor, would carry significant P&L and reputational risk for the carrier and the employer. The adoption rates are also telling. 40% for unionized employees, 27% for salaried or sole decision makers. These aren't universal numbers. Carriers need to underwrite the risk of non-adoption and the cost of securing and maintaining these systems, all while navigating a skeptical user base. What's the solvency impact if a carrier invests heavily and the trust gap persists?
Agreed, the trust deficit is real, but it's an addressable market challenge, not an insurmountable barrier. Carriers and brokers who lead with transparency and demonstrate the tangible benefits, personalized guidance, quicker access to information, will capture market share. The opportunity to improve employee experience and retention through better benefits understanding is a powerful ROI driver for employers, even with initial adoption hurdles. It's about careful, strategic implementation.
Careful, strategic implementation must include robust legal and compliance reviews, especially regarding data governance and algorithmic bias. The cost of getting it wrong far outweighs the potential efficiency gains if employee trust erodes or regulatory fines are levied. The actuarial models for projected utilization of AI tools and benefits need to factor in this significant employee distrust, not just employer enthusiasm.
Point taken, Aria. It's a nuanced play.
Moving on to our next urgent headline, the Gallagher report, also released yesterday, June 22nd, 2026, painting a clear picture of escalating health benefits costs. We're seeing substantial premium increases across the board. Fully insured group health renewals are hitting high single-digit to approximately 10% increases. Let's quantify that as more than 7% to about 10%. And for our self-insured clients, stop-loss policies are seeing mid-teens increases, with some cases pushing beyond 20%, meaning approximately 13% to over 20%.
Substantial is an understatement, Dorian. These are critical numbers for carrier P&Ls and solvency. A 10% hike on fully insured renewals directly impacts top-line revenue, but also necessitates a reevaluation of loss ratios and reserving methodologies. Mid-teens to over 20% on stop-loss is particularly alarming. This isn't just a pricing adjustment, it's a significant increase in underwriting risk.
Precisely, Aria. The drivers are clear. This data is gold for brokers. It empowers us to advise self-insured clients on proactive cost containment strategies, exploring alternative funding mechanisms, and engaging in robust employee benefits communication to manage expectations. For fully insured clients, it's about optimizing plan design and exploring voluntary benefits to offset rising core health costs. Employers are facing significant premium hikes, meaning they need robust strategies to absorb or mitigate these costs without compromising employee experience. This is where the broker value proposition becomes undeniable.
The broker's role is indeed crucial for managing client expectations, Dorian, but the core issue remains the carrier's exposure. From an actuarial perspective, we need to anticipate if these trends, specifically GLP-1 utilization and its long-term cost trajectory, are sustainable. Are current reserving assumptions adequate for these mid-teen stop-loss increases? We must model potential for adverse selection if employers, trying to mitigate costs, shift to less comprehensive plans. The impact on carrier capital requirements and solvency margins for 2027 and beyond will be profound. This isn't merely about adjusting pricing, it's about reevaluating the entire risk profile of health and stop-loss books. We need to analyze whether these increases are sufficient to cover claims and maintain statutory surplus.
And that analysis, Aria, will inform how brokers help employers navigate these turbulent waters, potentially exploring captives or direct contracting models more aggressively. It's a dynamic market demanding agile solutions.
Agile solutions built on sound actuarial principles, or the market will quickly correct itself, likely painfully.
Shifting gears to a new benefit offering, the DOL has provided welcome clarity on Trump accounts. On June 22, 2026, the U.S. Department of Labor issued guidance stating that employer contributions to these new accounts for minor children will generally not be subject to Title I of ERISA. This program is set to launch on July 4, 2026, offering a $1,000 Treasury contribution for children born between January 1, 2025 and December 31, 2028. Families can contribute up to $5,000 annually, and critically, state, local, tribal governments, charities, and employers can also contribute.
Generally not subject, Dorian, is a phrase that immediately raises actuarial eyebrows. What are the exceptions? The DOL's careful phrasing suggests there could be scenarios where Title I would apply, perhaps depending on the level of employer involvement, discretion, or specific plan design if these accounts become integrated with broader benefits packages.
While the intent is to reduce compliance burden, any ambiguity creates risk. Employers considering this as an ancillary benefit will need meticulous legal counsel to ensure they remain squarely within the generally not subject boundary. From a solvency perspective, carriers offering related financial well-being programs or administrative services would need to understand their liabilities and compliance obligations, especially if these accounts mature into a significant component of employee financial planning. It's not a free pass from all regulatory oversight. But the core benefit for employers is clear: a new, relatively low-friction way to enhance their financial well-being offerings. This adds another layer to the complex landscape of employee benefits, providing a tangible way to support employees' families. For carriers and brokers, understanding this new benefit is crucial for holistic benefits discussions.
It removes a barrier, Dorian, but not all barriers. There are still administrative considerations, communication requirements, and the need to ensure non-discriminatory application. The generally not subject clause implies that if an employer crosses a certain line, perhaps by exercising too much control or making contributions contingent on employment terms, ERISA Title I could be triggered. This would introduce fiduciary responsibilities, reporting requirements, and potential liabilities that employers are specifically trying to avoid. The long-term actuarial implication is how this interacts with existing retirement savings plans and potential impacts on overall employee savings behavior. We need clear, bright-line rules, not just general guidance.
We'll certainly be watching for any further clarification, Aria, but for now, it's a net positive for benefit innovation.
Our final critical update brings us into the legal arena. The Pharmaceutical Care Management Association, or PCMA, has filed federal lawsuits on June 22, 2026, challenging new pharmacy benefit manager (PBM) laws in Illinois and Tennessee. This is a significant development for the entire group health ecosystem. The PCMA argues these state-level restrictions unlawfully interfere with employer-sponsored health plans governed by ERISA.
And this, Dorian, is where the rubber meets the road on ERISA preemption, creating immense regulatory complexity and potential P&L impact. The PCMA's core argument is that the Illinois Prescription Drug Affordability Act's pharmacy network restrictions and reporting requirements would directly increase costs for self-insured employers.
Similarly, they assert the Tennessee law conflicts with ERISA and federal Medicare statutes by dictating pharmacy network design, potentially forcing the closure of over 160 PBM-affiliated pharmacies. This isn't just a legal spot. It's a direct threat to the efficiency and cost containment strategies PBMs are designed to provide. For carriers, TPAs, and employers, the outcome of these lawsuits is critical. If state laws are allowed to stand, we face a fragmented regulatory landscape. This would mean increased compliance complexities for multi-state employers, potentially higher administrative costs, and a significant challenge for PBMs in optimizing their networks and rebate negotiations. Brokers and consultants will be on the front lines, needing to meticulously track these developments to advise clients on navigating evolving PBM regulations and their implications for health benefit strategies.
Fragmented regulatory landscape is an understatement.
It's a compliance nightmare. From an actuarial standpoint, if state laws dictate network design or restrict PBM practices that drive down costs, we can anticipate a direct increase in pharmacy benefit claims. This means higher P&L exposure for carriers, pressure on medical loss ratios, and potentially insufficient reserving for future RX costs. The long-term impact on the affordability of prescription drug benefits for employer-sponsored plans could be substantial. Congress just recently enacted PBM transparency requirements, mandating disclosures of pricing, rebates, fees, and spread pricing to employer health plans starting in 2028. This federal move towards transparency could be undermined if state laws create conflicting or more restrictive mandates, leading to a regulatory tangle that ultimately drives up costs for everyone. Solvency risks increase if carriers can't effectively manage their pharmacy benefit spend due to conflicting state mandates.
It underscores the need for a unified approach, Aria. These lawsuits are a bellwether for the future of PBM regulation and its impact on cost management.
Indeed, and the actuarial community will be watching these court decisions with bated breath, as they will directly inform our future pricing and reserving strategies for pharmacy benefits. The stakes are incredibly high.
And that's our rapid-fire deep dive for today. Another incredibly dense, data-driven 15 minutes on Group Insurance Daily Pulse.
A critical 15 minutes, Dorian, highlighting the ongoing tension between innovation, risk, and regulation in our industry.
Thanks for tuning in. We'll be back tomorrow with more essential insights.
Stay solvent, everyone.